To understand breast surgery, we must first appreciate the anatomy of the breast. So the breast sits on a platform, and that platform is your rib cage and your sternum. Above your rib cage are your pectoralis muscles, and those are covered in fascia. And above that is the actual breast tissue, what plastic surgeons call breast parenchyma. And this is composed of fat and glandular tissue, and you can actually feel your breast, and you can feel the hard areas and you can feel the squishier areas. That's the fat and the glandular tissue. The breast parenchyma is covered in a skin soft tissue envelope, and on that skin soft tissue envelope is the nipple, which is the convergence of all your glands and your ducts. So why do people get cosmetic breast surgery? To simplify things, the breasts are either too small, they're too big, or they're too droopy. And droopy we call breastosis. So let's go over into each of these categories. The first category of patients present with small breasts. They usually come to my office and they present the same way. They say the breast tissue is confined to the area under the nipple. They don't like the scoop or the loss of upper pole fullness of the breast. And they actually put their hand on their chest like this and say, I have fat here in my axilla, I have fat and breast tissue under the nipple, but I don't like that upper scoop, and I want better cleavage, I want lateral fullness to the breast, and I want a bigger breast. These patients are candidates for breast augmentation, which can be done naturally with fat grafting or with implants, more commonly with implants. When you do a breast augmentation procedure, the implant can be silicone or it can be saline, and it can be placed above the muscle or below the muscle. The access, how you put in the implant, is either an incision in the breast fold, around the areola, or in the armpit. All are good options. The next category of patients are troubled by the size of their breast. They find that their breasts are too heavy, too low on their chest wall, and they don't just have aesthetic concerns, they also have functional concerns. So they might present with back pain, shoulder pain, grooving from their bra straps, and problems with exercise. These patients are extraordinarily happy because they don't just like the look of their breast after surgery, they actually have an alleviation of functional issues that have been very bothersome to them for a long time. The third category of patients present to my office because they don't like the way their breasts droop. And we call this, as plastic surgeons, breastosis. And there's a number of reasons why breasts droop. Age, weight fluctuations, breastfeeding, many different conditions, including just genetics, stretch the soft tissue covering of the breast, and over time the breast looks flatter, wider, and the nipple is too low. These patients need tightening of the soft tissue envelope to make the breast more conical, more spherical, rather than flat and wide. They also need their areola raised to a better position on their breast mound. If these patients have enough breast tissue, a breast lift is sufficient to really create a really beautiful aesthetic to the breast. But many times they lack volume in addition to having breast droop. And in these candidates, they need a breast lift in addition to placement of an implant.